manifest in studies of economics. And microeconomics itself is going through a big change. I teach micro, I studied micro, and of course a lot of micro, but this is really the realm in which a kind of a move to an institutional evolutionary economics. We won't get into too much of the detail about that right now, but cross-industry studies and the challenges of a micro-meso and a meso-macro debate are quite huge in economics. And they're huge for obvious reasons. If you take a firm, you want to know how does this connect to the whole economy. So you've got to ask this at different layers. Is the industry the intermediate layer, or is it something else? How is this governed, right? So those questions. Also, what makes the health industry so different? Now, all of you in this room are going to say, of course it's different. But if I put a bunch of folks studying semiconductors in the room, they would tell me, of course, the electronics industry is different. And if you gave me a bunch of people who work in aerospace engineering, they'll tell me, of course, the aerospace world is different. And I will tell you that there are remarkable similarities in the ways you study cross-industry patterns as well. So there's some interesting questions. If indeed some of those patterns exist, how do we work back and where's the science? So I would differentiate between science, engineering, technologies, and then the economy, right? And the relationships are a little different. So one of these debates is called Schumacher meets Schumpeter. Do you know who Schumacher was? Kind of the smallest, beautiful person, okay? And Schumpeter means Keynes, which is a much higher level macro order of. So this debate in economics is really crucial to all of you, because you're going to be seeing an awful lot of people trained in economics telling you they know how to take your industry into the future, or your science into industry, or your different fields of science addressed with a new economics. Okay, so it's important to understand that they come from certain kinds of prerequisites. And then this part, of course, I work a lot in this area and in this, and we won't belabor this point right now. Okay. So a lot of the debate for India has been about whether we can do this process better over time. And in fact, in the early 1950s, unto a point of quite substantial self-reliance, the debate was the move of India's late industrial development, if you like, was a kind of policy obsession with this movement. Firms go from this level of sophistication to somewhere here. And these were predominantly generic drugs debates. And a lot of the kind of technology questions were sort of this kind. And this led to a certain amount of both policy angst as well as certain real questions about whether firms could do what policymakers thought was necessary to do. And whether really, I mean, think about it, right? I mean, whether from a formulation standpoint or whether from a new science standpoint and so on, whether this was the holy grail or there was something different. Is producing bulk drugs from locally available raw materials the holy grail? Now, why this is quite interesting is that many countries look at their history of drug manufacture in these terms. And if you compare countries across this history of drug manufacture and ask what other kinds of learning, whether in the biological sciences or in terms of instrumentation or other fields, did they learn in this process? It turns out while a lot of countries look like they're moving down this, there are very few that have taken any one of these and actually built out substantial science or engineering capability. And India was a little different because India was trying to do both of those things or all of those things at once. And the reason it could be done was India made the argument that this was essential for nation building. Okay, so it was kind of a certain way of organizing science, claiming an economic purpose, as well, of course, as a health goal, and then making the claim that all hands to deck, this is what needed to happen. Now, very few countries, it turns out, actually can do all of this. And if you start looking quite systematically about what happened in India over time, you see that you have a first phase. Do people know what import substitution industrialization is? Anyone? It basically means that you make instead of buy. So you decide that there are a bunch of things that you need to buy, and you start making them, right? You force all your policies in the direction of making them instead. So this phase, approximately, constituted a first very determined public push, of which many legacy organizations came out, including CIFR and all the rest, not just in health, and then a private effort. And what we see, which is distinctive about the Indian case and not at all about most other cases worldwide, is this private effort completely transformed the Indian industry in this period. But I hasten to say it did not happen for all the traditional reasons. It happened because Indian firms went abroad or benefited from changing norms and organizational rewards abroad on the demand side, and built out, in combination with a bunch of technical standards, a very different kind of private effort. So while we ended up exporting, we did not export in the same way as most other countries. And while we ended up exporting, we ended up quite dependent on procurers of a certain kind and technical standards of a certain kind. And while exporting, we did not respond very much to domestic markets. So what is quite interesting actually just about this phase is, in fact, the quite dramatic increase in Indian private firms, even in generic drugs and some vaccines, ended up with a completely different profile in terms of organizational variety from what happened in most other countries, even those that had already significant on-patent, off-patent, or vaccine capability from before. And then this, of course, ends here, but really the question for us and something to debate is what this means for us with a great deal of uncertainty and none of this kind of nice tiered phasing that allows firms to learn. The reason I'm walking back and forth is I've been told this doesn't work and I tested it a couple of times. Now, moving rather quickly now, I'm going to say that maybe this shouldn't surprise us, that we have tiered trajectories in the economy in a big way. And the health industry is only one type of set of tiers. And what is quite interesting, of course, is that many of the technological waves that we have thought of course, have occurred in very specific social, political, physical contexts. So if you take energy power, for example, energy power is very closely linked to the rise of certain kinds of port cities or the rise of certain kinds of factories. Transportation moves you away into a certain kind of physical, political structure. Lighting, when you say lighting, who do you think of? Who's the guy with the bulb? So the genius of Edison was actually not so much that he came up with the light bulb. The genius of Edison was he was really a commercial and sort of finance policy guy in a remarkable way. Edison actually took the light bulb and did a very, very hard sell with the city of New York and other places. He worked very closely with tradespeople. He worked closely with commercial establishments that needed marquee lights to light up their new events. He worked with the public life of the city because he knew that, in fact, with lighting, once it was shown as a commercial venture, a lot more money would come in for other kinds of issues. So when we think of Edison, we think of him sitting alone in a lab. Well, I don't know who thought of that, but he was not that person. So what was quite interesting here is, of course, this changes quite dramatically, and he worked heavily to look at gas, utilities, to try and model electricity. So the lesson for him is, while he was working not just in terms of the engineering of the light bulb, he was working very intimately with the design of utilities and the commercialization for the middle class and business organizations instead of the poor. So many people, of course, have said, well, lighting, house lighting transformed the lives of the poor, and indeed it did, but that was not the focus of his attention. And that's actually quite different from what happened in India with lighting, and we can discuss that if there's time. Okay, so you can go down this list and you see that these waves of technological change come about usually because of very particular organizational and institutional norms in particular societies. All right, so moving on, you could do the same for drug generations and go back into the health industry and ask a question about drug generations. So here we are. This might be too small for all of you to see, but you see that these areas of the second drug generation that come about really have to do with very specific moments in industrial crowding, disease spread, colonialism, and so on. And so also for the fifth generation, this is what actually came about, and this is what, in a way, are used over on this side, which is the side of industrializing countries, which have very different social contexts. And you could ask the same question here, which is to say, suppose we asked a question of geography and not over time, how is it that you can have some of the worst asthma in the US in Harlem, New York, and also have one of the largest producers of prescription medicine we're not used to asking questions of this kind, right? People will tell you that's a nonsensical question. But actually, if you ask it from the standpoint of history or redistribution, the geography of access, it's quite interesting that those two coincide, that Merck sitting right there and Harlem sitting right there should be so close and in a way yet so far. But the reason we've done it is we've organized commercial production in a certain way, and we've made certain choices about the institutions of community health in a certain way. All right, so if you ask this question, how does an economy regulate access to medicines? What state regulation of market varieties shapes this access? And then how should we think about it in terms of geography? All right. Now, all of us know the guy with the beard. In this room, does everyone know the guy with the beard? No? Okay, you know him. But you probably don't know him. Who's him? Who's he? Okay, this is Schumpeter. Okay, and he's actually far more relevant for your story or any story in India about the economics of innovation than this guy. And this is not an ideological question. They were both actually very interested in types of evolution of the economy, but they both came to quite different degrees of understanding about the organizations that they were focused on and which ones might offer the greatest traction. But the ones that are particularly interesting are these two people, whom you almost certainly, in fact, I could bet you quite large money that no one here will know. But this is a guy called Alexander Gerschenkron, who wrote the theory of late industrialization. And this is a woman called Alice Amsden, who revolutionized the way we think about late industrialization and the industrial policy. So these two people actually are incredible exemplars of both of these traditions, but they're coming to it with a very particular understanding of industrial policy in the role of the state. And if you start looking then at the industrial elements, the point I said right at the beginning, the thread we pull on is that existing neoclassical and evolutionary elements are really quite deficient in describing innovation, and more strong supply of firms doesn't mean you necessarily do better. So the great irony in a way for India is our firms, the private firms, do very well, but they are not our firms, right? In a way, the more successful your firms are, they are less closely tied to the nation state. So all the things you might have done to make your firm successful, well, you should kind of step back. They're not yours. So it raises some interesting question of what exactly the national conversation is versus the conversation about the ecology of organizations and institutions. Did everyone, you got that, right? So the nation state kind of fades in and fades out of an evolutionary conversation, and it can cause quite a lot of discomfort because it's not clear who we are in this background debate about the economy. And then undersupply, of course, is nationally bound because health policy comes into being, and you usually do have quite clear boundaries of the nation state. So you could say, just to repeat a couple of things, if you start looking at these types of theories and you look at different types of innovation classes, not the heroic inventor type invention, but really different kinds of innovation, you would say that once you start approaching this from quite an evolutionary and open-ended standpoint, there's a whole debate between economics and biology about evolution that I will not get into, but suffice to say that we're not really talking about the same thing. You do get into kind of certain patterns of which organizations do you study and why. All right, do I have everyone on the same page so far? So we can sort of move quickly. So what we are really concerned with is once you start looking at variety in this sort of VSR process, you really start having to worry about these problems. The more you acknowledge, yeah, go ahead.
I just wanted to ask you, what's the definition of innovation?
Yeah, so normally what we tend to think of, this kind of ideas of innovation, is Schumpeter in particular, probably the guy who thought about it the most at that time, was concerned with many types of innovation that were well beyond the kind of heroic inventor model, right? He recognized that innovation was fundamentally tied to the entrepreneur in the economy. And Marx and Schumpeter differed quite dramatically about the implications for the economy, because for Marx, who were his protagonists? Does anyone kind of remember in his economy? Who are Marx's protagonists? Who are the main actors in Marx's world? Okay, there's labor, there's capitalists, and there's kind of a managerial class, right? That's a little different from the capitalist. The capitalist tends to finance, and then there's laborers. But the big fight then becomes about the kinds of organizations through which the norms of production convert into capitalist profits. And what is quite different about Schumpeter, Schumpeter also has some of these elements, but Schumpeter makes his main actor the entrepreneur. And the entrepreneur is an ambiguous creature. The entrepreneur is kind of both the manager and the capitalist, but the entrepreneur could also be the worker, depending on the type of firm. So, as you might imagine, the way I've characterized it, Schumpeter goes off in a slightly different direction about what the upside and the downside to innovation are relative to a Marxian analysis. There are some very interesting overlaps, and there's some quite dramatic differences. And so the types of innovation Schumpeter describes are also questions associated with, for example, organizational innovations, innovations associated with marketing, questions of social transformation, demand, pricing, and so on, right? So Schumpeter has kind of a slightly more nuanced understanding of innovation, and his ideas of innovation as a solution to all of the world's problems also differ from Marx. They're both actually quite, shall we say, ambivalent. Marx, perhaps the way we have been given to training and thinking, tends to be more clear-cut about the losers of innovation. And Schumpeter, depending on who the protagonist is that you are focused on, the entrepreneur could be, in fact, the winner, but the entrepreneur, depending on the entrepreneur as a worker or a financier or someone else, could in fact also be a loser. So risk plays a very different role in the two models, and therefore the kind of the scale up to business cycles is different. Did I answer your question? Okay, all right. So, all right. So once you have this messy feedback and regulatory open-endedness, you've sort of got to say, if there's an awful lot of variety floating around in your economy, lots of different kinds of organizations and institutions, how in the world do we start thinking about things like feedback loops, regulation, all of these things that we assume are within the ambit of policy? So I won't go into this, but it is quite interesting for those of you who are interested in class-based analysis, because there are some interesting questions to ask even of Schumpeter's model. How do we think about market share? Who should control it? Who is worried about loss of control? Where does labor regulation lead? The answers are quite different from a Marxian analysis, and of course, even in Marxian analysis, there are lots of different kind of ways to go. And I just want to point out that on Amsden, I'm not going to go into this in any detail, Amsden became very important because she played with the microeconomics, where price is not equal to the marginal cost of a product. And she was very interested in this, not because she was curious about this, but she was fundamentally interested in how the state helped firms make sure that this was in fact the case, that states became monopolies. States allowed firms to become monopolies. And then you end up with this problem. What I want to emphasize a little bit here, and this is a thread that perhaps is a question many of you ask yourself, and what happens when scientists are the bureaucrats? What happens to both science and the engineering and so on? If bureaucrats in her model are the feedback mechanism, what happens when scientists are bureaucrats? What's the model, what does that look like? Should in fact scientists be bureaucrats at all? Is the endeavor of the bureaucracy quite different from the endeavor of science? Are they checks on each other? Or in fact, is it good to merge these things? In India, we have assumed it is good to bring these together, not really see them as separate domains, but I think that's open to debate. All right, so one of the things that I did in the book was actually start thinking about different spheres of policy influence for the reasons I've laid out, which is that the institutions of production are quite different. This Schumpeterian or late industrial production, whether you think of it in Marxian, Schumpeterian or other terms, this has become the pivot of almost all of industrial policy for India. And these two are almost all of the domain of health policy. This can cause quite serious problems. As you might imagine, if this domain starts looking at this as just backdrop, then you run out of vaccines, you run out of things, you have bottlenecks, you don't actually address the problems of provision or delivery and so on. On the other hand, if you have these, and suppose you have clinicians or community health ventures, all the rest, and you don't have a tie into this, you never feed back into the systems of learning and improvement. So this becomes one way in which to organize it, and the way of thinking is not that these are separate spheres, but each of these historically in any economy has extraordinarily different institutions and organizations. So if you said market variety, well, this is a little market menagerie of its own, so is this, and so is this. And they do not speak to each other for the most part. This is not a technologically determinist story. In fact, every time technologies change, this conversation reappears in a different form. Just to make it a little bit more practical, when we think of this, we can think of insurance, right? Individual, you can think of individual payments, but you can also start thinking about things like procurement. Procurement becomes a very powerful way in which to force delivery of a certain kind, but it is fundamentally a production conversation. It forces firms to do certain things. So procurement can be very, very powerful if worked. One of the worries we have in India is insurance is a bit of a standalone. It seems to speak neither to this or this. So if you were someone worrying about regulatory questions on insurance, you should really be worrying about this relationship. This co-evolves over time. So no country is stuck in any one of this as a little static picture. All countries evolve, and some countries have very little of one or the other things, and I'll get to it in a second. Is this relatively clear? This piece, yeah.
Yeah, I was wondering if you could give an example of any country which has managed to get this.
Yeah, so I'll get there in a second. Yeah. So this piece is almost all that we have thought of science technology for health in almost every plan, because we have assumed somewhere floating in the ether here is a linear model. The linear model puts lots of people like you, brilliant minds in a room, great things happen, and somewhere a miracle occurs and it becomes industrial production. But you could ask your question and say, why aren't all you people in the room somewhere here, or somewhere here, or somewhere else? It's not clear. So the linear model, for example, has a very unclear relationship to this, which is a good thing, because we don't actually know what the presumed relationship of science is to industrial production. It has been assumed that you fund a TIFR, then you fund an NCBS, great miracles will occur, suddenly all of you will be incubating or talking or having lots of coffee and so on, suddenly companies are formed and you are here. That's a big if and lots of coffee. But if you are here, or if you are here, you might be having a different set of conversations, and you might be asking a different set of relationships about just this, or just this, or just this, and I'll get to it in a second. the more you focus on variety in the economy, the more you are likely to say, how do I jump? How about if I had organizations here, let's call them firms for a second, although by no means are they the only organization. Why is it that some firms go from here to here? How does an Apollo decide that they want to suddenly get into insurance? How does Sakra, that does maybe a little bit of this, want to suddenly get into something that deals with production and teleradiology? Okay? We can get into all kinds of interesting combinations here having to do with this set of questions. Okay. Actually, this is not rocket science, as you can imagine. This comes from a lot of study of the organization. And what becomes quite interesting is, of course, it seems to be a bit of revelation when you frame it this way. So this is a very particular type of evolution that has taken place in history over time, and I'll get to some of the countries that exemplify this. Go ahead.
Give an example of Sakra, just so I catch it.
Yeah.
How is teleradiology an example of industrial production?
Yeah. So remember that teleradiology, we would kind of think of just this here.
Sure.
It's a mechanism through which we think of delivery.
Right.
But teleradiology depends on an awful lot of things, which you know as well as I do, sit over here. Everything from instrumentation, right, to questions of diagnosis would sit over here, but the diagnostics increasingly also sit over here, right? So one question is, how do these new modes of delivery, suppose you started here and you said, forget India has any history of industrial production. We don't do instrumentation, we don't do generic drugs, we don't do vaccines, we're not interested. We just start with this empirical question. Somebody has some kind of disease, a community has a disease, we have some geography with a certain disease burden, and we begin here. What would we start doing here? If we began the clock here, we would end up with quite different design for here. India, in a way, has a love-hate relationship between these two. Almost all of our science and technology and engineering initiatives are focused on a love affair here. And we do, of course, care about this, and we do care about this, but it kind of all ties back into this dominating, right? But there are, and sitting in the Indian ecosystem, it's kind of hard to imagine not having this. But I'll get to some of the examples where you don't have this, and you've got to ask this. All right. So you could ask this question. You could say, how are these related? And this is not a traditional industrial policy, health policy divide. This is that uncomfortable new world in which policymakers are actually not really having a conversation, but neither are economists. And I hate to say it, actually, so also not a lot of health scholars. You had a question?
So who makes sure, whose responsibility is to...
No one at the moment, which is why it's quite exciting. All right. Or multiple people. Maybe that's the correct way. Multiple organizations. And there really is a jurisdictional mandate issue, which we'll get into, which is really the regulatory question. And then you could have a slightly different relationship here. You could say, suppose you are consuming and you're creating institutions of consumption of some kind, and you have industrial production, but you just don't know what the heck to do with this stuff. Well, actually, in India, we kind of did this. I pointed out to you that the second tier of Indian private sector build-out was exactly this. We took this from India and we sold it overseas. And we sold it through the welfare states of all those countries overseas. In fact, this is a kind of tier 2 Indian model. We didn't necessarily look at home. We said, well, insurance doesn't really exist. No, we don't do this. No, people are not buying, etc. So we did something a little bit different. But if you start looking at these sorts of classes of categories of problems, you could do this as well. I won't belabor the point. I want to take you just for a second in a divergence before I get to you to the country question. If you start looking at any one class, therefore, of problems, any one disease type, any one class of problem solving and framing, you end up with a set of questions that you could ask also by diseases. This was the work that IAVI commissioned me to do. IAVI is the International AIDS Vaccine Initiative, as you all know. And what they asked me to do was they said, is there any way, this is a big debate in-house, is there any way based on the kind of work you do, where you could push our people to think about public policy in new ways. And I said, sure, I'll sit and classify every one of your first licensures of vaccine in time. And I will tell you all the different ways in which research was organized. Now, this looks so nice in retrospect. It was just agony to do. Okay? It was really hard to hunt all this information down. But what was very fun was you can actually split this, right? Can you see this? It says public, government, and military or military, private sector, academic, non-profit. And what is very interesting when you look at all, so the debate that IRV was embroiled in was a lot of the biologists would say, well, it's HIV. The science is different. There are no existing animal or other models that make sense for us. How in the world can we look at history? Don't give me history as an example. This is an example not to give you history and hit you over the head with science analogies, but to ask how the process was organized. And then you can make your own lessons for whether, in fact, variety helps you to answer a specific question about science. That's really the way to think of it. So if you go back and you do this took a heck of a lot of mixed methods work. You can start splitting the process over time from 1945 down to over here. And if you start looking at this, you see some kind of strange patterns. You see that non-profits, exclusive non-profits, are almost never present. You can also see that academics kind of come and go. Academic research of a kind of traditional ivory tower, I'll think about deep problems of science. And then you can think about private sector comes and goes in different ways. You can see what we kind of instinctively knew, that the public or the army or the military played a critical role. Okay. The same one, done organizationally, just to reclassify, you see this. Coordination by a non-profit entity at the time was just this one case. And in every one of these, you actually end up with a much, much more detailed figure. Yeah.
Where would you place public-private partnerships?
Right. So if you go back here, you would say that in the history of this endeavor, public-private partnerships are newspeak for a mix.
Okay.
Right? So if you had to decipher what public-private partnerships, you'd say organizational variety. All right? Just remember. So almost all of these are cases of public-private partnerships. Right? So in the current speak, they should be glad. Practically everything organized in science was of that nature. And it always has been. But to a certain point of handoff, after a point to commercialize and deploy the vaccine, required the private sector. So if you're a private sector person saying, see, I told you so, well, you could point to the other side of the told you so, which is you never came into being without the public sector, in most instances. So there's some interesting questions here. Could you have done it differently? And when you actually, of course, speak to the folks involved in this process, many people, especially in the military or army research labs and so on, will tell you that pretty much any clinical trial, of course, was internal to the army, right? So you tested on all the hapless recruits, you tested on all the hapless civil populations, things that you can't quite do now. But you could also frame that a little differently. You could say, why is the cost of clinical trials, if people tell you, for example. In fact, I was in a meeting where we had all the famous big firms that do vaccine and other trials, and the answer that always came back, why are things so expensive, was that, well, it's very hard to do. And so somebody who was in the room who studies similar kinds of stuff said, well, then why don't we bring clinical trials back into the public sector? And after all, we're subsidizing this portion. Why not just bring back that trial piece back into the public sector and cut the cost? Acknowledge that it's subsidized. Why in the world are we building that into the cost of the final? Okay, now, we don't have to get into a fight about that right now, but I'm just saying what this allows us to do is to a little bit more systematically go back and look at whether or not, once you do this, then you can start saying which are analogous science models that might help a particular case. The eventual answer may be that there is no analog to a particular science, in which case that's fine. But without doing this, there are an awful lot of very hasty jumps from science to policy and from economics to policy that should not be made. All right, so now going back, if I reminded you about the 1, 2, 3 in the heuristic, right? This was the 1, 2, 3. One was this production domain. These are the characteristic economic activities in that domain. Here's provision delivery. This tends to be health policy. This tends to be health policy. And these are the kinds of things that we're interested in. Okay? So, to come to your question, what do countries look like over time? What is actually very interesting is that there are remarkably few countries over the last 100 years that have done anything remotely like managing all three spheres. Because each of those three is really weighty with a huge variety of institutions and organizations. So what you find is, okay, Cuba did it, Cuba sort of did it, but I hate to tell you, Cuba is not a democracy, right? So do we have any democracies that have done it? Well, Japan did it, but I hate to tell you, Japan did it under quite difficult circumstances. South Korea did it, but South Korea did it under debatable democratic circumstances. And some of the countries we tend to compare very easily, China, India, Brazil, etc., really should not be compared because they have extraordinarily different axes on which they built out their health systems historically. So one of the uses of this is to actually go back to kind of lab outreach endeavors, trying to think forward about how we think about the build-out of science. There's a big if whether science leads into the economy, but in areas such as incubation, science funding for certain diseases, the organization of the funding efforts, which organizations should be involved, all the rest, you can't do without this kind of analysis. So what you end up saying here is really, if you think of industrialized countries, really the first late industrializers, if you like, you tend to think of this, and then you tend to think of late industrializers. India really has kind of played around with 1 and 2, really 1, a little bit of 2, suffers through 3. It's extremely different from Brazil, which really played with 2, built out 1, and now building out 3. And of course, Brazil's in a crisis, so it remains to be seen what goes. Cuba forced all 3 together, but it's not a democracy. And if we start thinking of these, Sri Lanka did very well, actually on 1 for a while. And then, for a range of reasons, focused on 2 and 3, and then civil war came along. But you could start looking at this, and the United States, often called really a 1, has really struggled for 3. So when we think about the costing of technologies, when we think about where they're going, how they're building out, which countries to compare, this is a bit of a cautionary tale. There are very few comparisons that look like India, on the one hand, whether that's optimism or pessimism, that's up for you to decide. But also the other piece of it is that if you start thinking about relative strengths, South Korea and Japan look like quite interesting examples for us to look at. Okay.
You don't have UK there?
I don't have the UK there. And I think I put the UK in the book. I think the UK ends up somewhere. But no, I was really thinking of iconic, right? The Nordics are here, and I have Germany here. The UK has gone in and out as being a strong supplier. And so I was sort of looking also for strong supplier capabilities that died over time. You could also look at Egypt. You could look at Pakistan. You could look at Turkey, Greece, countries that have had traditionally strong supplier bases on the industrial production side of a certain kind and have ended up with very different relationships to the other domains. Okay, so if we start looking at this, and I will wind up here in about 5 minutes so we can open it up for debate. Does that work in terms of time? All right. This is the new drug policy that India came out with in 1978, and it was quite pivotal for India. And it has this, I don't know what your experience has been of Indian policy making, but in the domains where I work, it's quite traditional to have a very, very, very long list. And here's one. It's 1 to 9, and you could ask, from what I've told you, if you had to set priorities, given all this organizational institutional variety, my own hunch is that you might want to start with 5. and the others can be sorted, okay, as more or less important. But this was really the goal, but it's buried under 5. And so a lot of the debates about which instruments, how to use it, what are essential industries, which deserve policy attention, what should scientists do in the first plan to the nth plan, all of these are really debates about confusions about which domains in the triad these inhabit. Okay, so in some of my current work, I'm going back and looking at a lot of these policy instruments to try and see how they were deployed or how they were connected to these areas. And as you see, one of the reasons of the confusion is in industrial policy alone, which is the domain of that first part of the triangle, you have at least all of these and a lot more. All of these are policy instruments up for grabs. And if you wanted to say, how could I do number 5, make sure that drugs are available in an affordable, accessible way, and then look at this list, heck, there are lots of choices. And that debate is really quite messy. And this is the stuff that makes it extremely interesting for organizations such as yours, or you're thinking about the norms of science going forward, or the domains of activity for biology in the country. There's really an open question about the relationship to these and what spheres of influence you want to call on to make the argument that science, in fact, is relevant to the economy. Just in this alone, for example, we have a large grant going forward looking at India, UK, Kenya, and Tanzania. And one of the things we're doing is trying to understand whether Indian dominance in cancer diagnostics and cancer therapies more broadly is going to force African countries to lower this local content requirement for their own producers in a way that India becomes a substitute for their own industry. And that can be quite problematic. It might solve a health problem, but it can create quite long-term problems in terms of the relationship between 1, 2, and 3 in their geographies. So just to give you another version of that table I gave you in slightly more legible format, you can put countries along here. You can say which were the dominant institution bundles in a certain period of time. Remember, this evolves, right? This is not a static picture. You can also try and take a look at sort of supply side successes, and then you can take a look at health policy successes, which need not be the same. And if you actually look then at dominant instruments, you can pick specific countries, and you can look at very specific industrial policy instruments that tend to dominate in these countries. And this itself is quite telling, because it tells us that the domain of health policy isn't one domain. It interacts with industrial policy and innovation concerns in quite different ways. And you can do this across all of these countries, and you can do it for others. So the institutional triad, and I think this is just the last slide. Yeah, okay. What have we learned so far? If you don't want to view production success, the creation of firms, the creation of science capabilities, etc., as the dominant marker for a progressive or a successful economy, the triad in a way kind of rejects this notion that development is this production success. It's basically saying you have co-evolving institutional and organizational varieties. If you don't know how to manage this, then guys, you're in for some trouble. The second is a traditional, and this is really for a room full of economists, we would have a big fight about whether market failure theorizing is particularly useful, therefore, for the economics of health. And then this is, of course, traditional national comparisons break down. It's quite hard to look at that heuristic, populate it across countries and economic activity, and then say Nigeria and Brazil are the same, or India and China are the same, or whatever. What it does provoke us to ask is in which dimensions and on what types of institutions and organizations are China and India the same. And it can be very powerful for us to learn. It extends beyond a class-based view. And I think for India, this may be the thing that makes me very unpopular, but it has to be said that we are really stuck in a class-based view. And we view all problems through a class-based lens, and that can be very deeply problematic for several reasons, not just ideological ones, but several methods reasons. Inequality is not exclusively a class-based phenomena. It has several manifestations, and we need to ask what those might be. It is not determinist. You can start in a bunch of different places on that and ask, how should I move? How should I think about future policy? You can begin with technological innovations in any one of those domains and create that as your policy priority. Government, of course, acts in different domains. You do see the limits of the nation state. I can have, back in my heuristic, 1, 2, 3 can belong in different countries. They are not bounded by the nation state. So the idea that we want to do 1, 2, or 3 all in India is a story of long ago. It is not a story that serves us going forward. So we do have to have a different economics conversation. And then there are some very interesting questions for my work. I'm very interested in these issues. How do we think about where to start the clock? What kinds of methods should we use? Should we use forecasting, foresight studies, simulations? Should we use stochastic models, the different kinds of Bayesian other statistics, right? I mean, there's some interesting questions about how we think about iteration and methods. Because the moment you open up in kind of a co-evolutionary model of these kinds, knowing, of course, that evolution in the economics language means something slightly different, there are some very important questions about threshold effects, which organizations survive, do you have a survival bias to your organization, all kinds of other things. So let me end it there. This is a study we're just beginning in Tanzania and Kenya with a lot of colleagues, and I'm really delighted to see that there are other East Africa benches in the room, and I'm really looking forward to a longer conversation. Thank you.
I think we have time for a couple of questions, if anyone's interested.
It can be questions about economics, biology, whatever you like. Yeah.
Smita, my understanding of Africa is still new.
Yeah.
But one of the things that struck me in my few visits this year is that, in a sense, I've always argued that India should be more decentralized in general. But in Africa, actually, because they have so many countries and they have so many, borders between these countries, they have a challenge of, doing this triad of yours.
Yeah.
Because getting industrial production, getting the other units.
That's right.
And so, in a sense, if they didn't have borders, at least on some domains, in some activities, they would do better. Is that a fair comment?
Yes. In fact, that's true of India as well.
Yes, true of India as well. Yes. But I meant,
yeah.
India is larger, at least in some areas, we get away with it.
Yeah. So you could ask, why is that, right? So in India, we get away with it in a way because we've organized this as kind of a national framework. We rarely organize this as a state framework, but a huge lot of this is at the state level. So in a way, this feeds nicely into India's love affair with science, technology, engineering, because this dominates. In a way, these are subsidiary functions that we have to kind of try and figure out. That is changing. That is no longer true. We're trying to think of consumption instruments at a national level. We're trying to play with our constitution in a different way to try and understand what those instruments might be at the state level, whether it's insurance or other things. We're interested in data, big data questions now. Problematically, I think, not really seeing it in these terms. But you could argue that one of the reasons this is held together for a while, at least in India, or the semblance of holding together, is because this has dominated. And you're absolutely right. In the African context, one of the reasons they're having a Pan-African plan now, NEPAD has one, the African Union has a health plan around strategy, all the rest, is precisely because they recognize that either all of this gets imported, or they privilege some sites of production, testing, firms, all the rest in some African countries and not others. And from a demand side, they simply don't have big enough markets for some types of efforts to sustain these. So the regional configuration, kind of the African Union as a regional market, becomes quite important to play with this. And India's health diplomacy push through health to connect with Africa, of course, is good marketing in some ways. I don't mean it cynically. I mean it's good marketing because it is a way in which we have a shared understanding of problems and ways to engage. The worry is that if you don't think of industrial production as a domain of national activity, then you must ask whether Indian firms are going to actually be serious problems for Tanzanian firms or Kenyan firms or South African firms and so on. So if you start thinking at the level of the firms are not necessarily national. In some countries in Africa, the firms are still national. They are predominantly nationally owned. They might even be public sector owned. But for most Indian firms these days, what is Indian is becoming a big open question. And that raises a set of questions. What's the population under study here? Is it nationally owned firms? Is it firms traded on, a stock market? Is it something else? Is it firms that have capabilities, in which case we don't care how they are owned? But the mixing of science sort of diplomacy with science as an endeavor of study and science in the service of kind of a commercial push are quite different things. So I would answer yes, it is true that decentralized problems are best solved in decentralized ways in some respects, but almost every industrial policy instrument requires scale. You don't even get to industrial policy until firms of a certain number and industrial technology processes of a certain scale are both in evidence. Otherwise, it's only one firm here and one firm there doing what they do. Where industrial policy gets invoked, it's because firms themselves of a certain class, characteristic, and number have pushed a process or product technology or platform technology far enough that they becomes a critical mass. And this is a real problem for a lot of African countries, besides some classic stories like in South Africa or Kenya and so on. They're relatively few. So cancer for us is a good example because India has different classes of dominance in different areas of cancer therapy. And it could be in medicines, it could be in diagnostics or something else, and those provided all nested cases in a way to test the heuristic and to kind of play it out in foresight studies over time. I don't know if I answered your question.
Yeah.
Yeah.
You had this table of, public sector, private sector, NGOs.
For vaccines?
Right?
Yeah.
Why do you think NGOs have played such a small role? Why has the private sector come to dominate it so much? Because, this idea that everything costs so much, many of us believe it's a bit of PR and whatever, there are various reasons for it.
Yeah.
And many people don't believe it, including the Medicine Sans Frontiers.
Yeah.
Right? And they've now started producing their own drugs and they've shown that it's very little. So that always bothers me. Why aren't NGOs doing more? Because there are pockets where NGOs have done things on their own, even manufacturing drugs.
So, in a way, I'll answer your question maybe slightly differently. I would say that you could argue that what is considered here as non-profit, by the way, this non-profit, right, for polio, inactivated polio, right? That non-profit here was the March of Dimes, right? And the March of Dimes was a very particular kind of organization which required a huge amount of government and other support to actually scale. So I could be even more pessimistic about this and say, in fact, there is none, right? It's a very kind of iconoclastic example for this. But the organization that asked me to do this study is, in a way, IAVI, is a very particular kind of intergovernmental, non-governmental, trans-governmental effort. With a lot of corporates. So it's a classic case of kind of a hybrid model that thinks and it actually comes back to Sudhir's question, because one of their classic problems was how do we deal with centralization, decentralization problems? Because suppose we know that, in fact, one of the first groups that contacted me about this little heuristic, who knew it was going to be so popular, was MSF. To say we now suddenly see that in this we can start making a different policy argument for access to medicine. which we had not done before. So when I was talking through this with them, it was quite interesting to think that something as simple as this opened up a conversation. But why it's interesting for IAVI was that IAVI was basically saying, we have tended to place science and industrial production here, but almost all problems of Africa or disease propagation or questions of epidemiology or questions of community health feedback lie here, and this can only be addressed in a decentralized way. That is, we can't possibly do this and this in the same place. It's asking too much to ask Rwanda to do this and do this in one lifetime. And it is true that if you focus this as your kind of ambit of inquiry, this is a good 50 years for most countries. There's no getting around it. The evidence doesn't show any different. It takes a heck of a lot to do this. Now that may change. We have different technologies at our disposal, different kinds of science.
Can I ask Gayatri's question, the same question in different way? Does the ownership of NGOs in some way create a sort of plateau effect? Because
what, a plateau effect? Okay.
Well, the argument being that, because NGOs are perceived or have sort of, small domain kind of, they're built around certain notions of scale which are small.
Yeah.
If there were NGOs which were essentially able to scale,
yeah,
then you maybe that what I'm saying poorly, but is that NGOs have a scale problem.
So NGOs have, they have several problems, and actually a lot of my early work came out of working with NGOs. So the reason for studying health and economic development together was really to try and understand why they saw it in certain ways, and they are very different. It's a very diverse population of NGOs. There's no one prototypical NGO, right? So one problem, if you see here, if you look across all first licensures of vaccines, is it's a heavily specialized domain. Even if you take just one area, right? And you start looking at applied research, or you start looking at development and trials, you start thinking of academic work, start looking at testing. These are highly specialized, and the reason in some of the public sector models the Army is invoked repeatedly is because the Army is one of the few organizations that has those capabilities. It has research wings. This could be any army, but in many of these cases it was groups like Walter Reed or others. You have massive populations at your disposal, rightly or wrongly, ethically, but you have them. You also have enormous funding possibilities. So in a way, the Army is the perfect storm in a way to build out vaccine research, and it's no surprise that an awful lot of vaccines came out of that work, not least of which is to protect the folks on the ground. Okay, and it's usually your army people. But one question that raises, of course, is whether any other organization has that kind of scale. We could ask your questions differently. We could say, do academics have that kind of scale? Should universities be in this business? In fact, repeatedly, when I was involved in this study, just on HIV vaccines, the number of times I have heard organizations of a different kind, not of the academic variety, saying, what the hell are academics doing getting involved in this space? They only know a piece of it. They don't have the capability to do it. Why are they involved? Why aren't they collaborating in a way to get this off the ground? What's the goal here? Now, in these cases, if you start working backwards and you say, here are the first licensure, the goal is licensure of a vaccine, you would ask a very different question than if you started here and say, how should we populate this column? How should we take basic research and populate the column would be a different answer from, we've got to get it to licensing and deployment. So it's not surprising. This is like Rashomon and Kurosawa, right? Everyone has a different lens depending on which kind of piece you populated. But you're right to say that NGOs and other organizations neither have the scale, but they have a piece of the learning that is incredibly vital, but that does not translate necessarily into either the insights or the methods that might be absorbed into the organizations that do have scale. To turn that on its head is to say that the organizations that do have scale also are not trained necessarily to work on the ground, right? So there are some real problems. How do we think about the domains of the triad from the standpoint of who is learning, Who is building? Where are the feedback loops with all of this variety? And if you think of kind of the economy from that vantage point, you start asking a very different set of questions of the kind you're asking. Why shouldn't NGOs do some things? Why should academics do other things? Yeah. And you know, of course, that in today's health world, there are many permutations, right? There's PAS, there's IRV, there are, of course, all the global funds trying to do a little piece of everything. So the picture has changed a bit. Yeah.
Sorry,
Yeah.
just in the interest of time, since we're running over, if it's okay, we can take it outside.
Yeah, I'll be happy to.
We'll meet for tea outside. Thanks, Smita.
Thank
again.
you very much. Thank you.
Thanks all for coming, and we'll see you next month. The talk would be looking at the history of surveillance technologies.